Well, probably a lot like many people, when I was deciding to do the surgery, I was looking around and seeing who's good and what's the price. And I settled on Turkey, like many people have, and that's kind of where I got the idea. It's going to be reasonable price, maybe like, $2 a graft. They're supposed to be good. They do a lot of operations there. So everyone says they have a whole industry there. So I was thinking, yeah, why not go to Turkey? Sure. I mean, I could save, compared to doing it here locally in the US, maybe it's going to be $6 or $7 or $8 a graft, or even higher, 10. So I was thinking, oh yeah, $2. That's so smart to go do it. And then I did it, and the results, I never even quite knew for myself. I always looked at it 6 months later, a year later, 2 years later. I was like, what? I don't even know what happened exactly. I know that there's some extra there, but it never gave me the feeling that I made a good decision and that I was happy with my hair. I was like, okay, maybe it's a little different. I think it's a little different. So long story short, a few years later, I'm thinking, look, I gotta get another one done here. I mean, this can't be the best. This can't be the end all of my hair. So, and this time I said, look, let's keep it. Let's pay a little more. Okay, maybe you do get what you pay for. I started looking locally in California. I'm in the north. I looked south. I said, I even looked in Chicago or other areas. I was just wanting to find who is good. All right, this time we want to find someone who's good and knows what they're doing, and I'm gonna pay more. I'm not gonna pay an exorbitant amount, but I'm gonna bump up from $2 a graft. I'm gonna go interview them and see, how do they speak? What do they think about the whole process? And immediately during my search, I found some good doctors. I mean, immediately it was different the way they were talking about it, the care, and then especially when I got to Dr. Sean Behnam. And it was already from the beginning, I could tell. I mean, he cared about it, and he had answers to everything. And that's all talk. At the end of the day, when you get it done, that's when you see the results. That's when you really know. And immediately after the procedure, I remember thinking, just the post-care that Dr. Sean had me do, taking care of for the first 48 hours of spraying the grafts with nutrients all the time. I mean, really looking after it, bathing it, and taking care of it so meticulously right after and before, even a little prep. And I knew right there that this was a different game. This was a different doctor. This was a different procedure. And I was already confident that something good was going to happen. And this was just right after the procedure. And then here I am, 7-8 months out. My hair is, it's fantastic. And this is, I did go to a motel and use their shampoo. So it's not as great as it was yesterday, but I'm telling you, I look at it in the mirror and I'm just amazed. I look at it every day in the mirror and I think, this is what I wanted from the procedure. And the cost was not even, what I found out was that, and nobody really talks about this online, when they're talking about price. Yeah, this guy's good, whatever that means. But nobody really talks about the important factor, which is the yield. The yield, they can take 3,000 grafts, 4,000, 5,000. In my case, they took 2,400. And out of those 2,400 they took in Turkey, I'd be surprised if 500 or 600 still remained. I think they got like a 30% yield, 20, 30, at best 35. And that's what counts, because they'll take whatever, you come in there a hair virgin, and they'll take they'll take all your grafts because they don't really care about it. They know they're not going to see you, so they'll take 2,000, 3,000, 4,000. And that's the other thing, is you don't realize that you think when you're starting that, oh yeah, hair transplant, but really it's, you have a limited number of grafts, and the most important thing is what is the yield that the doctor is going to get. If they take 2,000, are you going to be left with 1,950, or are you going to be left with 300? And that's the whole thing. And I saw immediately with Dr. Behnam, it was like, wow, he took 1,600, and I think out of those 1,600, he got 95% plus to stay, you know. And it was like, for taking 1,600, he got hundreds of percent better result than the people who took 2,400. So it was no contest. And the price, it was like, yeah, it was a little higher, but not even, I mean, it's all about the yield. Nobody's talking about that. That's the key there. You gotta know what the yield is. And with a good doctor, I know Dr. Behnam is a good doctor, and they're getting very high yields. They know that is at the end of the day, that's it. And they do everything in their power to get that done. I'm so happy that I found him, and that I could become his patient, and he could work his mastery on my head, because I wake up every day and I love it. Again, I mean, I would never, I hope people can see this and think about a little harder before making their decision. I know at the end of the day, there's money involved, but you've got to understand the word yield and what that means, because it doesn't matter if you find someone who does it for $1 a graft or 50 cents a graft, they'll take all your grafts and nothing will remain.
And that's really unfortunate. Now look, I'm not really trying to bash or put any other doctors or facilities down, and there are great doctors everywhere in the world. But however, in the United States, the way we approach hairline and the way we view hairline is a very conservative, mature, natural hairlines with 1s and 2s and 3s, and you have to have it. If not, you know, it's not US appropriate. It has to be age appropriate, it has to be natural. And these things, and I find that in my experience, I'm going to take a look while I talk, that what really creates naturalness and high density is the doctor doing 1 case a day, focusing on you at that time, right? Having a good staff, doing the punching himself or herself, and assuring high quality.
And I knew that, you know, when Dr. Behnam told me that he only does 1 a day, and then during the procedure, he was telling me, I mean, well, I think that, you know, your scalp is kind of a little special, or may need this extra treatment beforehand to ensure that the grafts take hold. And he really, I mean, when I went in Turkey, it was just kind of, the doctor was there for 5-10 minutes, you know, to oversee a few things, and then he was out to another patient. And I think a lot of doctors they run clinics where they're doing 5, 6, 7, maybe 10 a day. So the doctor cannot give you the care. He just doesn't have the time to do it. I'm sure he wants to, but that's the way the business is set up. So finding someone who cares enough to limit the procedures they do in a day, because they know that at the end of the day they have to be there, they have to understand the individual needs of the scalp and oversee the whole process, because again, they want to ensure maximum yield at the end of the day there. So, you know, I knew the way that Dr. Behnam operated himself and just took his time, and he noticed things. I mean, he noticed because he had the time. He knows that it's an art form, and you really have to study your subject and understand, appreciate the differences, and that just takes time. And I'm just glad again that I found someone who cares. It's about caring enough.
Perfect. Well, congratulations. It looks great.
Thank you.
Awesome. Thank you.
It's amazing.